So what is bullying? Bullying really falls under the big umbrella of what we call youth violence. And the way CDC defines youth violence, it's violence by any person ages 10 to 24 years old against either another person, a group, or a community, with that youth's behavior likely to cause physical or psychological harm. And under the umbrella, you see different types of youth violence, with bullying being just one of those subtypes. I also want to note that although we define youth violence as violence committed by a person aged 10 to 24, that certainly does not mean that we believe that prevention efforts need to wait until age 10 to be initiated. They should certainly begin well before that. Next slide, please. So what is bullying? This has actually been a subject of much debate, but generally it's agreed upon that there are three characteristics that define bullying. And that's that the behavior is unwanted and aggressive behavior, usually among school-age youth. The second characteristic is that it's repeated over time, or there's a concern that it could be repeated. And it involves a real or a perceived power imbalance that favors the perpetrator. And by perceived, we mean it could be something, for example, of perceived social status, someone being of a higher social status than someone else. It includes actions like making threats, spreading rumors, attacking someone physically or verbally, or excluding someone from a group on purpose. And we'll talk about these subtypes in just a minute. So why does this all matter? Is this just a bunch of researchers discussing theoretically what bullying is? No, that's not the case. It actually matters significantly how we define bullying. First, it has significant implications for prevalence. If different surveys define bullying differently, then we get widely varying estimates of how prevalent bullying actually is. Second of all, if it's defined differently, we get varying risk and protective factors, varying things that might increase or decrease the likelihood that someone is a victim or perpetrator of bullying. And third, all of this informs prevention strategies, what might be most effective. For example, if it's general peer aggression as opposed to bullying, then a conflict resolution strategy might be appropriate, whereas with bullying, with the power imbalance, that type of strategy would not be appropriate. Next slide. So as I said, there are different subtypes of bullying. There's the physical bullying that I think was the more traditional form that folks think of, with the physically larger child being physically aggressive towards a smaller child. There's verbal bullying, indirect bullying, sometimes called relational aggression, where the intent of the perpetrator is really to harm relationships. And then there is electronic aggression, and we intentionally here at the CDC have called it electronic aggression rather than bullying, only because in the electronic environment it's sometimes difficult to tell if the behavior meets those three criteria. In other words, is it repeated if it's just posted once but viewed hundreds of times, and if there's a power differential. Next slide, please. So how prevalent is bullying? The 2011 Youth Risk Behavior Survey, which is a nationally representative survey of kids in public and private schools in grades 9 through 12, found the overall prevalence to be just over 20%. And here you see the breakdown by sex, with girls significantly more likely to indicate having been bullied on school property during the 12 months before the survey than boys. The 2008-2009 school crime supplement data, where we see the prevalence a bit higher, which makes sense because the subjects, the participants, were slightly younger, and we know that bullying actually peaks in middle school around 6th grade. And again, we see the sex difference here, with girls more likely to indicate victimization. And then the 2008 National Children's Exposure to Violence Survey, which actually goes down to kids ages 10 through 17. And we see here that the most prevalent form of victimization is emotional. And then finally, the 2005 Health and Behavior of School-Age Children, another nationally representative survey, shows here that boys are actually more likely to experience physical bullying than girls, and report being more likely to experience verbal bullying than girls. But for the remaining three types, girls indicate that they're more likely to be victimized. Next slide. So this is the YRBS data, again, kids in grades 9 through 12. And we see here the sex differences I mentioned earlier, but we also see here some racial ethnic differences, with white youth being more likely than Hispanic or black youth to indicate victimization on school property. and Hispanic youth being statistically more likely than Black youth to indicate victimization on school property during the 12 months before the survey. Next slide. This is data from the school crime supplement, and the males are in the purple color and the females are in the aqua color. And here we want to see it similar in terms of females being more likely to indicate victimization either at school or being cyberbullied anywhere. What I wanted to draw attention to here is though certainly cyberbullying is prevalent and is an increasing public health issue that we need to pay attention to, it still remains that kids are generally about 4 times more likely to experience bullying victimization at school than they are to experience cyberbullying anywhere, which certainly does not mean that we don't need prevention and intervention strategies for cyberbullying. It just means we certainly can't ignore the bullying victimization that occurs on school property. Next slide, please. Here is the Healthy People 2020 bullying goal juxtaposed with the Youth Risk Behavior Survey data. And here we see the trend, as I mentioned earlier, in terms of bullying peaking in middle school and then decreasing with each subsequent year. So we see it's more prevalent in 9th grade and decreases in each year. And then that black line represents the 10% decrease that we are hoping to bring about by the year 2020. Next slide, please. Again, we have data from the school crime supplement, students who reported being bullied at school, and that is the purple bar, and those who reported being cyberbullied anywhere, the aqua bar here. Here I want to draw your attention to the fact that for those who indicated they were bullied once or twice a month, that's still more likely to happen at school than cyberbullying, although those who indicate bullying once or twice a week, it was slightly more likely that they reported that for cyberbullying. I also just wanted to draw your attention to the adult notified, the far right bars, that those who were bullied at school were slightly more likely to notify an adult than those who were cyberbullied, which makes sense assuming that there's more increased supervision at school as opposed to wherever a young person might be, for example, when they receive a text message. Next slide. So this is data from actually the 2001 Health and Behavior of School-Age Children Survey. The reason that I'm including it, even though it's somewhat outdated data, is because this is the last time from a nationally representative survey that we have data about the reasons that the victims thought they were bullied. And here we also see the importance of the definition. If we look at the ever column, for example, if we look at males bullied ever, you'd see the most prevalent type of victimization would being hit, slapped, or pushed. But if we look at frequent, which is once a week or several times a week, then the most frequent type is being belittled about looks or speech, followed by being the subject of sexual comments or gestures. And being belittled about looks and speech and being the subject of sexual gestures are the types of reasons why females indicate they were bullied most frequently as well.